We, the children of the world, all have the same rights. One of the main challenges man has encountered throughout history has been always trying to have enough food. Let's imagine and transport ourselves to the past, and let's think how society has changed according to the available resources to satisfy its needs for food. If we could agree on anything at all, it's that always, at any moment of human history, from its very beginning to this very day, now everybody has been able to grow according to their social development, and many brothers have stayed on the outside, carrying on their backs the ghost of malnutrition. By malnutrition, we understand the lack of nutrients in our bodies, either in quality, quantity, or equilibrium. Malnutrition, according to its degree, can be light, medium, or severe, and it's determined by several factors such as weight according to height, size according to age, development of complexion, or according to the results the lack of nutrients are causing on the child, such as the condition of his hair, skin, and his mental and physical development. According to UNICEF statistics, 14 million children under the age of 5 die every year in the world due to malnutrition, and 150 million children survive with deficiencies in their health and development. The picture of malnutrition in Mexico is not hopeful if we base it on 20 million Mexican children who have some degree of malnutrition. If in Mexico, half of its population is under the age of 18, it means that half of the young population in Mexico is not well fed. All this without including pregnant mothers, adults, and elderly people. We know that the human brain starts developing from the very moment of gestation. This means in the mother's womb, after birth and up to 5 years of age. But what happens when a pregnant mother has some degree of malnutrition? And what happens to a child under 5 years of age victimized by malnutrition? The lack of good nutrition for the pregnant mother is very serious, since it can cause a deficient development on the baby even before birth, or even death to both of them. And the baby born with low weight doesn't have enough defenses and can be constantly victimized by sickness. Malnutrition in children under 5 years of age affects their physical and mental development, and in many cases, it's permanent damage, since they are not able to resist a common or light sickness which a well-fed kid can easily do. Therefore, a child with low nutrition cannot advance at school. And when he gets older, he becomes a deficient adult which cannot prosper at work, closing at that a circle of low capacity, unemployment, low income, and terrible life conditions, sentencing their children to repeat the same mortal circle, reinforced also by an uneven social and economic system. In the city of Guadalajara, Jalisco, Mexico, a group of people aware of the malnutrition problem in children decide to work in an organized way to help the children. That is how, in 1954, the ORganismo de Nutricion Infantil, Asociación Civil, a private charity institution, was established. In the same year, the plant and offices were started of what would be Organismo de Nutricion Infantil, ONI. In charge of His Excellence, the Archbishop of Guadalajara, Mr. José Garibi Rivera, and the following year, the President of Mexico at that time, Mr. Adolfo Ruiz Cortines, inaugurated the plant in which they work up to now. The main objectives of Organismo de Nutricion Infantil from the very beginning were very clear: to give the complementary nutrients to babies under 3 years of age, whose parents due to their economic situation, couldn't provide them with the right food. From its beginning, and for many years now, the ORganismo de Nutricion Infantil has given away bottles of low-fat and rehydrated milk. In 1988, the milk was replaced by the powdered meal we call Nutrioni, which contains powdered low-fat milk with A and D vitamins, sugar, corn flour, and whole soy flour, meals that we can provide thanks to the support we get from the government of the state of Jalisco and from the people and institutions working with ONI. All special children have the right to receive education, medical treatment, and all the care they need. The ORganismo de Nutricion Infantil distributes the Nutrioni in 48 centers located in the impoverished areas of Guadalajara. It has also given support to the Huichol zone in Jalisco and other towns throughout the state. To accomplish their goal, the ONI has a team of social workers who survey the area surrounding the distribution centers, trying to find out the socioeconomic situation of the families in the area and their nutritional condition, and to determine the existing infant population. In each of the distribution centers, the social workers have the support of a volunteer person from that place, who is in charge of the Nutrione distribution. Each week, they give 14 envelopes of Nutrione per child, which equals 28 rations of food for the 7 days of the week. The social worker keeps a control card in which he registers the personal and family data for each child, his socioeconomic condition, his nutritional history, and a monthly checkup of his weight to evaluate his progress. Also, they jot down the observations of their visits to the children's home. Nevertheless, the ONI work is not reduced to the delivery of meals and the evolution control of the children, but it's also interested in the improvement of the family environment. Therefore, it organizes study groups with the mothers of the children, during which they share their experiences and receive lectures on health, nutrition, and family improvement. It also has a special attention program for children with the most severe cases of malnutrition, and who might not only need Nutrioni, but also would require a special diet or the supplementation of iron and vitamins. ONI works together with other institutions to support families who might need special attention other than the services provided by them. To accomplish its work, besides the social workers team, ONI has an administrative staff, a production staff, in charge of making the Nutrioni, and also a board of directors to administrate and guide their activities. We want to reach more children, to open new distribution centers, to get new alternatives that will allow us to develop new feeding programs, and to revive our spirit to give a more professional service. To accomplish our institution's feeding the children objectives, we depend mainly on the contributions of conscientious and reliable people to help our work at ONI. Such work has been hurting due to the decrease of their economic support and of the rising